What's the difference between a psychologist, a psychiatrist, and a mental health therapist? Today I'm going to answer that question for you guys, and as always, subscribe and hit the notifications button if you like learning about topics in mental health and psychology. The order I'm going to talk to you guys today about these is psychologists, then psychiatrists, then licensed mental health counselors, then social workers, and then life coaches. And I'll talk from the perspective if you're interested in these as a career, and also if you're curious about potentially seeing one of these professionals for therapy. So psychologist is a really broad term, so I'm going to have to break that down for you guys a little bit. Within psychologists, we have, after their title, you would see either PhD or PsyD. So the first difference I'll talk about is in terms of training. So a PhD would have gone to 4 years of doctorate level training after their bachelor's program, and those 4 years would have focused on research for them, conducting research with a professor and trying to come up with new findings in psychology, discoveries that are going to move the field of psychology forward. For example, they might conduct a research study to see if one form of treatment works better with volunteers for depression versus another type of treatment. Now, a PsyD is also going to have 4 years of doctorate level training after their bachelor's degree, but their training is going to more focus on learning evidence-based treatments that they can implement to help clients as a psychologist. And it's not going to focus on research as much. It's just going to be hand-on, helping people in clinical settings. Included in a PsyD's training would be 2 years of a practicum placement where they're working out at an agency or a hospital or somewhere where they're actually learning how to help clients, and at the same time they're being supervised by a licensed psychologist. They'll also have a 1-year internship after that, getting more training and supervision, and then 2 years of a postdoc after that, getting more training and supervision. So a psychologist will definitely be experienced and knowledgeable. Next are psychiatrists, and after their title, you'll see the letters MD, which stands for Doctor of Medicine. So this person's actually been trained similar to your family doctor that you've been seeing for years. They went to 4 years of medical school after their bachelor's degree. The difference is that after those 4 years, they went to 4 more years that specialized in psychiatry and learning how to treat people with mental health disorders using the medical model, and most often using medication as the main treatment form. So these MDs, they could work in private practice or at a hospital, and if you meet with them, it'll be for a brief session, more brief than a psychologist, where the psychiatrist checks in with you on how your medication's working. They'll adjust the medication if they need, if you're having any side effects, or they may prescribe a new medication altogether. Another type of mental health professional is a counselor, and after their title, you may see the letters LMHC, which stands for Licensed Mental Health Counselor. So each state has their own licensing requirements, but often these counselors will have 2 years of graduate level training after their bachelor's. And within this training, they've usually done a 1-year internship where they've worked at an agency under the supervision of another counselor to learn and train. You might be wondering what the difference between a counselor and a psychologist is. And the main difference is that a psychologist can give assessments, for example, personality tests or IQ tests, and then based on your score on the assessment, their observations and other data, they'll give a formal diagnosis. So a psychologist could formally diagnose you with depression, for example. Whereas a counselor, they can't give assessments and diagnose, but they can still meet with you and use talk therapy to work through the issues that you're experiencing to get better. Another type of mental health professional is a social worker, and after their title, you would see the letters MSW, which stands for Masters of Social Work. So this person has gone through probably 2 years of graduate level training, but the difference is social workers are focused on the big picture, the macro effects of what's affecting the individual or the family. They're trained to have a social justice view, and that's what they work towards solving. So rather than focusing on the individual, social workers will often work with family units as a whole or communities to help connect the family with resources. This happens a lot at community mental health agencies or in schools. When I worked at a school, I worked really closely with the school social worker, and if a student had racked up a lot of absences where they weren't coming to school, the social worker would help the family to get the child to school or see what barriers were preventing them. Was it housing issues or financial struggles that the family needed help with? And the social worker is a really important part of that puzzle, connecting everything together. A social worker might also work in the juvenile justice system or the Department of Children and Families. If we're concerned that a child is being abused, we call the DCF hotline and report it, and then a social worker makes a home visit where they go out to the home and inspect the living conditions. They try to interview the parents and make sure that that child is safe. Another title that you may come across is someone calling themselves a coach or a life coach. So you just want to be wary that people calling themselves coaches, they don't need a degree or any special qualifications to call themselves a coach. They can have a website with marketing and advertising that's really appealing, and they may be offering their services and charging you a lot, but a coach doesn't have to follow ethical or legal guidelines like a psychologist does. And a coach also is not necessarily following evidence-based treatments. They're just following what other coaching strategies they think may help you. So this isn't to say that you should never see a coach. There are some great coaches out there. For example, my favorite is Tony Robbins, and he leads amazing workshops, seminars, and he's helped thousands of people. But Tony Robbins won't tell you that he's had doctorate level training. Tony has his own philosophy to help people, and it's very shocking and energetic, but it works. If that's what you're looking for and you're not really concerned about someone's qualifications, you could see a coach for help with finances, dating, exercise goals, simple things like that. If you're thinking about going into one of these professions as a career, you just want to think about what you enjoy spending your time doing. Do you enjoy doing research? Do you want to be a professor, or do you enjoy doing one-on-one therapy? Do you want to prescribe medications? Do you want to work with families or children? Or do you just want to be a coach and help people with day-to-day issues? Each one of those things that you're interested in is going to match up better with one of the careers that I talked about earlier. And it's not to say that one of these professions is better than another. They're just different in the way that they treat people, in their philosophy, and the way that they work. Now, if you're looking to one of these professionals for therapy, you want to ask yourself some questions like, what are the qualifications that I'm looking for? If you want someone that's had 4 years of training at the doctorate level, you're going to want to see a psychologist. Also a psychologist if you want a formal assessment and diagnosis. Or do you want medication? Then you're going to want to see a psychiatrist. If you're against medication, you wouldn't see a psychiatrist, you would just see a counselor for talk therapy. Another critical component if you're seeking therapy is just to see if the therapist is a good match for you. So when you go into your first session, make sure that you feel comfortable and that you feel a personal connection. And if you don't, then you don't have to go back. But that sometimes can be equally as important as their qualifications, is just finding a good match and fit for you. So I hope that helped define a little bit of each title and career path and who you might want to see if you're interested in seeking therapy. I know it's really confusing out there because psychologist, psychiatrist, the name is so similar, most people don't know the difference. But if you have any further questions, just comment below and I can answer those for you.